So today and yesterday I took Raelynn to the hospital and she received an IVIG treatment. That stands for Intravenous Immunoglobulin. Basically what it is it's a infusion that boosts her immune system. And there's been some evidence that this treatment can reduce or even eliminate seizures for people. There's also other that says that it doesn't do that, that it's inconclusive. We don't know exactly what it's going to do for Raelynn, if it's going to help or not, but
You're right.
we thought we'd give it a try. She did have a seizure yesterday and today during her treatment. I didn't get yesterday's on video, but this is her recovering from her seizure yesterday. I took her mask off her during her seizure just because she didn't like it. I don't know if I was supposed to or not, but the nurses didn't say anything. But she definitely felt a lot better without her mask on while she was having her seizure. More comfortable. And this is her after her seizure. She was just resting, fell asleep after her seizure. Oh, she did during her seizure flex such that the IV treatment wasn't going into her arm anymore. So they had to take it out of that arm and put it in the other arm. So yeah, she fell asleep. But that was our first day, and then the second day we went back again. The first day was a longer treatment. It took about 5 hours to get it, but the second day was a lot shorter. It was only about 3 hours. And that's because the first day they had to actually work up to how fast they could give her the treatment. But the second day they could start at the faster rate because she was tolerating it just fine. Here's her second seizure.
You okay?
But fortunately, she waited till after her treatment was over to have her seizure on the second day. Although she still had to do labs, so we were concerned that the port would be blown at that point. But fortunately it wasn't, so she was all good and she got her labs and went home. I'm going to upload the full seizure that Raelynn had in the hospital tomorrow, but make sure to subscribe so that you can find out if the treatment is ultimately effective for Raelynn. I'll make sure I update you guys on how frequent her seizures have decreased or increased, however they are, in the weeks to come.